Did you know that quarantine increases urinary tract infections? Apparently it does. We've been getting a lot of phone calls in the office with patients reporting urinary tract infections and that burning sensation and urination. And it makes sense. A lot of the patients are at home and they're in quarantine and they're having sex, but we don't have to stop having sex to decrease the risk or prevent urinary tract infections. So I put this video together to give you more information about what causes UTIs, how we can prevent it, who's most at risk. I hope that you find this interesting and even informational. As I always say, knowledge is never wasted. And if you find this interesting and think that anybody can benefit from it, please share. So I'll move on with the video. Urinary tract infection is essentially when bacteria enters the bladder or the urethra that overgrows and causes an infection. Most often this bacteria comes from either the rectum, from the vagina, from sex. It can also come from areas like the perineum, which is the skin between the rectum and the vagina. It can come from douches, from spermicides, from many different things, which I will discuss in more detail in this presentation. Let's talk about urinary tract infections, or UTI. Urinary tract infections is an infection in any part of the urinary system. That may include your kidneys, your bladder, or the urethra. And the urethra is that little tube that goes from the bladder to the outside, which is the area where you pee. The symptoms of a urinary tract infection are often that burning sensation when you pee, that having to frequently go to the bathroom, feeling like you haven't emptied your bladder completely, some pelvic pressure. Sometimes people have that cloudy urine. Sometimes people have a very smelly urine. Very rarely you may have some blood in the urine. However, the most common symptom is that burning sensation, but not everybody gets that symptom. For example, pregnant women can be asymptomatic, and sometimes the elderly can be asymptomatic. And for the elderly, their sign is usually mental confusion. Sometimes a very mild urinary tract infection, something that you might not even feel. You may have a little bit of bacteria in the bladder, and you can flush that out with just fluids and urinating more frequently and flushing that out. But sometimes that urinary tract infection from the bladder can really travel into the kidneys and get into your blood, and that can cause severe illness. Now let's review again where the bacteria comes from urinary tract infections. The most common place where they come is from the rectum. The rectum and the urethra, the area where you pee, is so close in proximity that many bacteria that normally live in the rectum can easily travel to the bladder and cause a urinary tract infection in women. In men is much more different because the distance between the rectum and their urethra is much longer than it is for women. The other way that women can get urinary tract infection bacteria is for it coming from the vagina. And the vagina has many normal bacteria that live there. Sometimes the overgrowth of abnormal bacteria to the vagina can also enter the urethra and cause a urinary tract infection. Other places where bacteria can come and enter the vagina and the urethra include via oral sex, via intercourse, but using spermicidal agents, using contraceptives that go into the vagina like the NuvaRing, like a diaphragm, using hormone replacement therapy like the FemRing. There are also some women that anatomically are different, in which they have the perineum, which also has a lot of bacteria because of its proximity to the rectum, that a short perineum can increase the risk of urinary tract infection. Some women who are menopausal or perimenopausal have vaginal dryness, have thin walls to the vagina. Many times the pH of the vagina changes, allowing for other bacteria to grow that normally don't grow in the vagina, and the overgrowth of those bacteria can enter the urethra. Another way of getting UTIs, believe it or not, is using sanitary pads and panty liners. Those pads, not only do they hold on to bacteria, but they also often allow the bacteria to grow, and it kind of creates a quick and easy highway from the rectum into the vagina and the urethra for the bacteria to travel. So for those women who are using sanitary pads or panty liners that are using it not when they're on their period, simply because of maybe vaginal discharge or urinary incontinence, if we can fix urinary incontinence, if we can fix the vaginal discharge, then the goal is to never have to wear a pad unless you're on your period, to really decrease the risk of not only vaginal infections but also infections to the urinary tract. Other things that can cause it is wiping from back to front. Obviously that brings bacteria from the rectum and the perineum into the urethra. Some women suffer from urinary leakage again. That should be fixed in order to decrease the risk of urinary tract infections. Women who douche, also the douche alone can clear out all the good bacteria from the vagina, and that allows for bad bacteria to grow and enter the urethra and cause a urinary tract infection in addition to a vaginal infection. Sometimes using pessaries, and for women who have bladder prolapse, they also have an increased risk of urinary tract infections. In summary, how do we prevent urinary tract infections? Drink plenty of fluids, wipe from front to back, always pee after sex, avoid any douches or panty liners, sanitary pads unless you're on your period, avoid diaphragm or any spermicides. Also, you can increase in your diet. Probiotics are very good to decrease the abnormal bacteria in the vagina that can enter the urethra. Things like yogurt and kombucha are actually really good, decreasing the sugar in the diet as well. And lastly, if you have a UTI, please consult with your doctor, as you may need antibiotics, because if untreated, a urinary tract infection can really lead to worsening of an infection, which can also lead to sepsis. Thank you for listening. As I always say, knowledge is never wasted, so please share with anyone who may benefit from this presentation.